Hello, my name is Ashley Dennis, and I will be talking about the phantom limb. A phantom limb is the sensation that an amputated or missing limb is still attached to the body and is moving appropriately with other body parts. Such a sensation can occur with a wide variation of body parts, from teeth extractions, such as phantom tooth pain, amputation of the breast, or even removal of an eye, also known as phantom eye syndrome. Oftentimes the limb will feel disfigured, such as a shortened arm, as in Mirabelle's case. Mirabelle, in Chapter 3, was born without arms. She uses prosthetics and has experienced phantom limb as far back as she can remember. She gesticulates with her phantom limbs, which was an example she gave to Dr. Ramachandran, presenting how she knew she actually had phantom limbs. Mirabelle felt her arms were 6 to 8 inches too short. She explained to Dr. Ramachandran how she feels this way, which was how, when she wears her prosthetics, her phantom fingers should fit her prosthetics like a glove, which they don't. Along with the sensation of a phantom limb, there unfortunately comes with most patients the sensation of a strong pain, known as phantom limb pain, or PLP. This occurs in a majority of those who lose their limbs, though not all those who suffer from phantom pain necessarily need to lose a limb to experience the pain. It also occurs in conditions in which the brain is disconnected from the body, such as peripheral nerve injuries and after a spinal cord injury, when an area becomes devoid of sensation or consciousness and usually paralyzed. Phantom limb pain is a complex phenomenon that includes a wide variety of symptoms ranging from tingling and itching to burning and aching. During the past 20 years, researchers have advanced a number of theories to explain phantom limb pain. Such theories include maladaptive changes in the primary sensory cortex after amputation, also known as maladaptive plasticity, a conflict between the signals received from the amputated limb, proprioception, and the information provided by vision that serves to send motor commands to the missing limb, and vivid limb position memories that emerge after amputation. There are many contributing factors which may make the phantom limb pain worse, such as exhaustion, putting too much pressure on the phantom body part, changes in the weather, stress, infection, and an artificial body part that does not fit properly, poor blood flow, and swelling. There are many explanations behind phantom limb pain, such as damage to nerve endings, or subsequent erroneous regrowth can lead to abnormal and painful discharge of neurons in the stump, and may change the way that nerves from the amputated limb connect to neurons within the spinal cord. There is also evidence for altered nervous activity within the brain as a result of the loss of sensory input from the amputated limb. Until recently, the dominant theory for causation of phantom limbs was irritation in the severed nerve endings, or neuromas. When a limb is amputated, many severed nerve endings are terminated at the remaining stump. These nerve endings can become inflamed and were thought to send signals to the brain. These signals, being functionally nonsense, were thought to be interpreted by the brain as pain. Treatments based on this theory generally fail. In extreme cases, surgeon would perform a second amputation, shortening the stump with the hope of removing the inflamed nerve endings and causing temporary relief from the phantom pain. But instead, the patient's phantom pains increased, and many were left with the sensation of both the original phantom limb as well as a new phantom stump with a pain all its own. In some cases, surgeons even cut the sensory nerves leading into the spinal cord, or in extreme cases, even removed the part of the thalamus that receives sensory signals from the body. In the early 1990s, Tim Pons at the National Institute of Health showed that the brain can reorganize if sensory input is cut off. Hearing about these results, B.S. Ramachandran, realized that phantom limb sensations could be due to cross-wiring in the somatosensory cortex, specifically in the postcentral gyrus, which receives inputs from the limbs and body. The input from extremities comes into the somatosensory cortex in an ordered way in reference to the somatosensory homunculus. Ramachandran reasoned that if someone were to lose their right hand in an accident, they may then have the feelings of a phantom limb because the input that normally would go from their hand to the left somatosensory cortex would be stopped. The areas in the somatosensory cortex that are nearer the ones of the hand, such as the arm and face, will take over or remap this cortical region that no longer has input. Ramachandran first demonstrated this remapping by showing that stroking different parts of the face, such as with a Q-tip, led to perceptions of being touched on different parts of the missing limb. Through an MEG, or magnetoencephalography, which permits visualization of activity in the human brain, Ramachandran verified the reorganization of the somatosensory cortex. For those who suffer from phantom limb pain, they're advised to perform activities to lessen the pain, such as keeping the remaining part of the arm or leg warm, or missing body part, moving or exercising the remaining body part, or taking off or putting on a prosthesis. For those who have swelling in the remaining part of the body, it is suggested to wear an elastic bandage. It is also suggested to try gently tapping or massaging the stump. There are many over-the-counter drugs which are used to help with pain management, such as Tylenol, aspirin, or ibuprofen, such as that in Advil or Motrin. Some treatments include drugs like antidepressants. Spinal cord stimulation, also known as SCS, can be effective treatment for phantom pain. An electrical stimulator is implanted under the skin, and an electrode is placed next to the spinal cord. The nerve pathways in the spinal cord are stimulated by an electric current. This interferes with the impulses traveling towards the brain and lessens the pain felt in the phantom limb. Instead, amputees feel a tingling sensation in the phantom limb. Vibration therapy, acupuncture, hypnosis, and biofeedback may also be used to treat phantom pain, but are often of little help, unfortunately. The pain can sometimes be helped by keeping busy and focusing attention on something else. Virtual reality has also been used to combat the discomfort caused by phantom limb syndrome. Scientists from the University of Manchester have shown that phantom limb pain can be relieved by attaching the sufferer's real limb to an interface that allows them to see two limbs moving in a computer-generated simulation, such as that video that we had witnessed from the Chapters 1 and 2 presentation. There is such a device as the mirror box, which we will see in class. In a mirror box, a patient with phantom limb pain would input the good opposite limb into the box, such as an arm or leg. The patient would then look inside and see the reflection of the mirror in its symmetry appear as the missing phantom limb. Through the use of this artificial visual feedback, it becomes possible for the patient to move the phantom limb and to unclench it from potentially painful positions. Based on the observation that phantom limb patients were much more likely to report paralyzed and painful phantoms if the actual limb had been paralyzed prior to amputation, Ramachandran and his wife, Rogers Ramachandran, proposed the learned paralysis hypothesis of painful phantom limbs. Their hypothesis was that every time the patient attempted to move the paralyzed limb, they received sensory feedback through vision and proprioception that the limb did not move. This feedback stamped itself into the brain circuitry through a process of Hebbian, H-E-B-B-I-A-N, learning, so that even when the limb was no longer present, the brain had learned that the limb and subsequent phantom was paralyzed. The mirror box technique has helped a number of patients who once struggled with phantom limb pain, as we will see with this demonstration, a short video clip of Ramachandran's documentary. With this, it's a very simple and cheap technique which helps ease the pain of phantom limb, so it has a pretty major impact. Thank you.